Making sure dads stay healthy is something families should prioritize during Men's Health Month, especially for those in a minority population where barriers to good health care still exist. We have the pleasure to welcome Dr. Charles Modlin with MetroHealth. Good morning. He's one of only 20 African-American transplant surgeons in the entire country. It's great having you here this morning. And our first question for you, it's what's the best way men can prevent some common health problems?
Well, I wanted to first thank everybody for having me on down at Channel 5. It's a really great opportunity to educate the men about how to stay healthy. And I wanted to congratulate all you fathers out there for what you do for your families, your children, your community. So there are a number of ways in which men can stay healthy. But one of the most important things is that they can educate themselves about what it is to be healthy, what it means to be healthy. And National Fathers and National Minority Health Month, as well as National Men's Health Month, they're all opportunities to step back and make a personal assessment of what our own health situations are, both our physical health and our mental health. And more, we understand the importance of actually paying attention and addressing our mental health. So there are a number of things that men can do. And I would always say that it's important that every man has a primary care doctor. If you haven't seen a doctor in many years or recently, it's important to establish care with a primary care doctor. But I think men should also, every man should have a urologist. Urologists are medical and surgical specialists who specialize in the diagnosis and treatment of men's health conditions. So men should know what their blood pressure is. A normal blood pressure is less than 120/80. You should know what your pulse rate is. A normal pulse rate is between 60 and 100, depending on your age. You should know what your lipid level is. That's the fats in your blood system. Men 40 and above, especially minority men, should know what their PSA is. That's that prostate cancer screening blood test. It's very important that you know what your personal family medical history is and communicate that to your families, because your personal family history in many instances indicates what types of screenings you should have and at what age you should start screening for. You should actually know your immunization status. And again, there are several immunizations that are suggested that you have at various time points in your life. Very important to know about that. We've all been talking about the COVID vaccinations, but there are other immunizations that are very important that you become aware of. The CDC actually has a comprehensive listing of what are the recommended immunizations and at what time points during your life. You should know what your vitamin D level is, what your fasting blood sugar is, hemoglobin A1C, what your kidney score is, what your kidney function is. There are a number of things that you should know to stay healthy, and it's very easy to do that by establishing care with a primary care provider, but also with a urologist.
All right. Thank you so much, Dr. Modlin, for speaking with us today. And if you're a father, happy Father's Day. We appreciate your time.
Thank you. Appreciate it.